So with this, we come to very commonly asked plotting. That's for the kidneys. I'm going to plot kidneys from anteriorly and then turn the body over and show you how to plot the kidneys posteriorly as well. This is all the theory we have. Okay, let's plot it to understand. It's not difficult at all. Take a point 5 centimeter lateral to the midline on the transpyloric plane. That's the midline. I'm going to take 2 points 5 centimeter lateral to it. Right. Draw a line 2.5 centimeter long concavity medially, but on the right side it's going downwards. On the left side it's going upwards. Did you see that? On the right side it's going down. On the left side it's going up. Now you have to draw an upper pole of kidney and a lower pole of kidney. Upper pole of kidney 4 centimeter above the upper end of the curved line. On the right side here, on the left side higher. Lower pole 4 centimeter below but 7.5 centimeter from the median plane. Remember, your kidneys are not like this, they are like this, right? So the upper pole is much closer, the lower pole is much away from the midline. So these are the plots for the lower pole. Okay. Now mark a point 5 centimeter lateral to the first point here. Let's join this to form the kidneys. Right kidney, left kidney. Can you see how right is a little fatter but a little lower? The left is a little longer but slightly higher. These are your right and left kidneys. Let's put them back in place. There you have your kidneys. What is left then? Of course, the ureters. So, how do you mark the ureter? Mark the hilum of each kidney as shown. Take a point 5 centimeter below the transpyloric plane at the same distance lateral to the median plane. 5 centimeter below, 5 centimeter lateral. Mark a point on the pubic tubercle, join the 3. Join the 3 on both the sides. There you have your ureters shown as drawn anteriorly. Okay. So now this is all we have drawn. We still have to add the renal arteries to it. I have an aorta already. So it's going to be very easy for me to draw the renal arteries, typically originating from abdominal aorta at the level of L1, L2 intervertebral disc, just below the superior mesenteric artery. See, I'm drawing the artery. See the position of the artery. It's very posteriorly placed on the right side as well as on the left side. Remember, right artery is slightly lower down than the left artery. These are my right and left renal arteries. So how do we locate the kidneys on the back? It's important since most of the time they are accessed from there. Okay. So let's draw them again from the back as well. Okay. So now I've given you this PDF as well. Use it. We are looking at the patient lying on his abdomen. Okay. These are the vertebrae. I have marked them from T11, L1, L11. It's all marked there. And that's the 12th, 11th, 10th and 9th rib. Okay. I hope you get that. Orient yourself first. Your patient is already turned. Draw 2 horizontal lines through the 11th thoracic and 3rd lumbar spines. Okay, this is left, this is right. Through the T11 and through the L3, 2 horizontal lines are drawn. Okay. Now I want vertical lines. Okay. So draw 2 vertical lines, 2.5 centimeter and 9.5 centimeter from the midline. Right. So what do you have? You actually have a parallelogram, which is called as the parallelogram of Morris. Asked, okay? It's asked. Even though you have much better ways of plotting, parallelogram of Morris is asked very often in exams by your senior doctors. So do please prepare for this. Parallelogram of Morris. Inside this, we're going to fit our right and left kidney. So mark out the hilum of kidney 4 cm from the median plane opposite the lower border of first lumbar vertebra. Which plane am I talking about? Of course, the transpyloric plane. So 4 cm on either side is the transpyloric plane. Within the parallelogram, draw the outline of kidney so that the upper end is nearer to the median plane, lower end is away from it. Remember, the right kidney is going to be drawn lower down, the left is going to be drawn slightly higher up. That's up to your discretion, but remember that has to be done. From here, you have to now draw the ureters. There, you have your right and left kidneys. Happy? Okay, we are right there. We're almost finished with this class. Have patience. From that hilum, mark 2 points which are the posterior superior iliac spines. They're actually seen as 2 tiny dimples on the back of the patient. Join the hilum to the dimple and you have your right and left ureters. Okay, and there, fantastic. You have marked the kidneys on the and from anteriorly as well as from posteriorly. Right. So, my dear students, if you like this video, do please like, share, and subscribe to my channel. Remember to hit the bell icon